Hi, this is Dr. Dhillon. In today's video, I want to talk about how much does a teeth cleaning cost and how long does a teeth cleaning take? Both are very related to each other, so that's why I wanted to talk about both at the same time. These are two of the most commonly asked questions that I get at the dental office. You know, the answer is unique to every person. A good analogy is cars. For instance, as cars get older, they require maintenance, obviously, and some people will have cars require very little maintenance. Now, it has a lot to do with how you use them as well. Some people abuse their cars more than others. Some will have a lot more mechanical problems than others. You know, and our teeth and our gums are kind of, in a way, a bit of a similar thing. They require maintenance. Things, unfortunately, sometimes go wrong. Some people have more things go wrong than others, and some will definitely require more work than others. Unfortunately, with our teeth, we can't swap out our teeth like we can with our cars. So when it comes to our gums, everyone's problems are unique. Therefore, we'll have some patients where literally we'll have, let's say, a husband who has lots of gum problems, and his wife could have very little, and she may need very minor maintenance, and he might need, unfortunately, very extensive maintenance for us to maintain our teeth. Ultimately, the most important things to remember are, if you have a lot of bleeding of your gums, that is a serious problem. If you have deep pockets, that is a serious problem. And if you have recession of your gums, that is a serious problem. And if you have all three, it is a super serious problem. And in each one is correlated with shortened life expectancy of your teeth. And ultimately, we need to decide what a game plan needs to be able to extend the life of your teeth as long as possible. Nowadays, you know, we routinely have patients in their 80s and 90s who have vast majority, if not all, their teeth. Going forward, I think most patients that I come across do want to be able to maintain their teeth for the rest of their life and would like to avoid dentures. And being on top of their cleanings is critical for that to happen. So regarding the price and the number of appointments for hygiene, ultimately for most adults, we recommend, like when they come in, let's say as a new patient, is generally we do like approximately a 1-hour appointment for the hygiene component, which could include typically anywhere between 1 to 3 units of scaling, a polish, and fluoride for most of our adults. We do an assessment as part of that appointment where we thoroughly probe all the gums, measure the pocket depths, the depth, you know, between the gums and the teeth, and we measure the amount of bleeding, and we measure the recession. And based on those measurements, we can determine how healthy your gums are and how much maintenance that they will require. There are some patients with more advanced gum disease where we will need to see them ideally for a few visits. If it's been a while since their last time, we got a lot to catch up on to get their gums healthier. And then once their gums are healthier, we need to see them more frequently. We may need to see them every 3 months. And likewise, we have other patients where they have fantastic, healthy gums, you know, where they just need a more minor amount of maintenance. And we may even see them every 6 to 9 months for a hygiene visit rather than every 3 months. So before I talk about the fees, please hit the subscribe button and please smash that thumbs up for the like button. It really helps our channel grow. Now, regarding the fees of our office, we do follow the Alberta Dental Association and College Fee Guide. Our fees are listed on our website for the basic procedures that we do during a hygiene visit. You can also call our office and we'll be able to give you the exact estimate that we typically do for, let's say, adults or for children. And you can find out exactly what it is like, as well as if your dental insurance, how it plays a part with the fees. Typically, most adults get 1 to 3 units of scaling for that first hygiene appointment, plus, you know, polish and fluoride. And we'll have a link below of what that fee guide is like, so you can figure that out. And like we were saying before, the number of appointments is determined by your individual needs, and we will let you know of that during the appointment after we've done the full assessment of your gums and your teeth to give you a good idea of where you are in terms of any disease process. Thank you for watching the video, and please, once again, subscribe and like our videos so we can help our channel, and we'll catch you next time.